Hello again. I'm Dr. Dana Brackney. I'm a professor of nursing at Appalachian State University, and the following presentation reviews Module 1 content related to the harms of substance use. The outcomes of screening tools used to assess substance use behaviors are usually described with the following terms: hazardous drinking, at-risk drinking, healthy alcohol limits, binge drinking, low risk, no risk, and more. So there's many terms. However, it's important to note that the commonly used term alcoholic is not synonymous with at risk. Alcoholic is a term related to alcohol dependency and is one that people commonly use, but it's not related to what we're doing here. SBIRT is about harm reduction, the harm reduction process that we use to screen all people for substance use risk. It's called universal screening. The historical risk distribution of people screened places the majority of our population at no or low risk. People in this category of risk still need to be affirmed in their health behavior of abstaining from substances, and even those at low risk can be informed that increased risk could place them at risk for dependency on substances or other harms. So know that even if someone has what would be called a healthy screen, there's still some things that you can talk with those folks about. And also that most of your screens will be in that category. However, those who are identified at risk and or dependent need to know that their substance use places them at increased risk for injury, perhaps social problems, even criminal justice involvement related to driving under the influence, child endangerment, mental health consequences such as anxiety and depression, or even work-related problems such as absenteeism or workplace injuries. I'd like you to take a moment now to reflect on the problems perhaps you've noticed when you see people binge drink. This is one of the questions in the learning management system for you to answer and reflect on. It's important to recognize that we have seen the impacts of, or most people have seen the impacts of alcohol use in their friends, family, or others, and reflecting on this and recognizing it is an important um, practice in becoming a effective healthcare professional. So before we go further into binge drinking, let's talk about alcohol use by teens. This is particularly concerning. Teens age 20, uh, well, they're not quite teens, but 12 to 20 consumed 11% of all alcohol sold in the US, and 90% of their consumption is binge drinking. Binge drinking is defined as having four or more drinks for girls or five or more drinks for guys on one occasion. Most alcohol consumed by young teens ages 12 through 14 is obtained without financial cost to the teen. It's very important for parents to be aware of this because alcohol in their home may be diverted for teen use. Now, in teens and others, brain physiology and the development level of the team place them at an increased risk related to physical and mental health, as well as the legal or developmental risk related to underage drinking, such as a DUI or academic challenges, being removed from sports teams, other kinds of social risks. The numbers for guys and gals are similar, except that 14 to 15-year-old girls binge drink more than boys of the same age. However, by the age of 16 or 17 years of age, boys and girls have similar use patterns. Girls do drink more alcohol than boys across all of the subgroups. Sadly, binge drinking is not uncommon. Assessment and reduction of binge drinking is necessary to reduce harm and death. This list provides both long-term and short-term consequences of binge drinking. Some of these could be considered both immediate and long-term consequences. Sadly, every year nationally and even on our own campus, we hear about the death of older teens due to binge drinking. Let's look at the survey data for college students. Data from the NIADA, the National Institute on Drug Abuse, indicated that 33% of college students had been binge drinking in the 2 weeks prior to the survey. 76% of students aged 19 to 20 reported having 10 or more drinks on at least one occasion, and 14% of students aged 21 to 22 reported having 10 or more drinks on at least one occasion. College students who exceed daily drinking limits are exposed to the harms associated with unsafe sex, sexual abuse, and academic problems. Our most recent App State data is more than a decade old, but at that time it indicated that 21% reported binge drinking of those who responded. We did have a low response rate for this survey with only 7% responding, which is not uncommon in survey research, but it indicates that the numbers here at App State are actually quite similar to national averages. In a little slightly more recent, just before COVID, there was a 2017-2018 alcohol and other drug data that was collected that demonstrated the majority of students use alcohol, and a majority of these students used alcohol prior to college, coming to college. About a third of students used marijuana, and most of those were users prior to college as well. 4% of students used prescription pain or other illicit drugs, and half of those using these other drugs began that prior to college. So locally, a large number of students could benefit from harm reduction related to their own substance use. In 2020, during COVID, the use of alcohol, especially among those ages 30 to 59, increased 19% from 2019. And so it was hypothesized at the time that this age group might have been using alcohol to cope with work and home demands related to schooling of children, working from home, and being at risk or in working in the community. Use of alcohol to cope is a behavioral pattern that could lead to dependence. Overall, men increased alcohol use by 14%, and women increased use by 17%. Women's use is particularly concerning, with also being at the same time there was an increased rate of pregnancy. Let's take a look at some marijuana facts. Marijuana activates the endocannabinoid system to alter brain activity. About 1 in 10 people actually become addicted to marijuana, and we've seen that this has become even more problematic as the concentration of the active THC in marijuana, as that percentage has increased. So, unfortunately, addiction rates have increased 60% in those beginning use of marijuana prior to the age of 18. The THC in marijuana is stored in fat, and the brain is 60% fat. In state with legalized marijuana, children who have higher body fat percentages than adults are being exposed through unintentional consumption of edibles, through breastfeeding, and these are creating both physical and mental effects on children that are rather concerning. Now, there are physical and mental benefits of marijuana that have been demonstrated, and these are, however, very specific to two populations, and I can perhaps think of a third too. Some of it is for people with a very specific type of epilepsy that is treated with marijuana as a third option if the first two preferred medications to manage the epilepsy seizures are not effective. It's also used in generally in men with late stage HIV who have lost their appetite, and it's thought to be an appetite stimulant, and it's been showed to benefit those folks. And then in extreme cancer situations where people are also needing more of an appetite stimulant, marijuana has been demonstrated to improve. The harmful effects of marijuana are really not popular to discuss. In general, the public believes that marijuana is harmless. The studies reported here are associations, so it's what we see marijuana use being associated with. It will take a while to get very solid random controlled trials to study these effects. What we do know is that if people are prone to mental health disorders, if they're self-medicating with marijuana, they can have a 6 or more fold risk for conditions such as schizophrenia, like within 20 years of use as a teen. So similar to alcohol use, marijuana has a negative effects on health. We do know that physical performance is decreased with marijuana use, and that relationships and productivity, as measured by employment, are decreased among those who use. There is strong evidence for the decreased cognitive function among users with long-term and heavy daily use, as measured by IQ, and also all-cause mortality rates. Other documented harms include severe nausea and vomiting, which is especially interesting because, like I said, marijuana is itself used in these conditions. But there are newly released studies on the effects of marijuana on infants of mothers who use it during pregnancy, and these reports found negative outcomes for infants. Therefore, the use of marijuana during pregnancy and while breastfeeding is not advised by the American Academy of Pediatricians. Then when we look at adults, the increased oxygen demands that are caused by increased heart rate during marijuana use has been found to increase the risk for heart attack. And marijuana users have more respiratory complaints and illnesses than matched pairs of non-users. Marijuana use is largely accepted in the US, and it's due to changes in public opinion and in part responses to abuse of the justice system and severe punishments for marijuana possession. However, experimental studies of the causes of healing and harms related to the effect of marijuana are lacking. People in general can be suspicious of science, and so the use of harm reduction techniques and the use of evidence-based practice by healthcare professionals is an important role in protecting the public from these harms. The CRAFT screening tool for teens now includes a vaping question. Vaping is popular due to being less noticeable by parents and employers. Vaping of THC and nicotine has been dramatically increasing among teens and needs to be included in screenings regarding substance use with the CRAFT screening. Comes down to respect. SBIRT includes a brief intervention. Multiple professionals use screening combined with motivation interviewing with positive personal regard and openness for teens. In my experience, teens welcome these conversations because the purpose is not punitive or judgmental and empowers teens to make informed choices about their health. However, use of motivational interviewing takes practice. Each encounter is different and requires a skillful interviewer to get results. This is likely why the research shows less effectiveness in SBIRT outcomes than its potential for positive outcomes. Are you not working with teams? Well, no worries. SBIRT is for everyone. It's universal, and most people can benefit from harm reduction of some sort. There are lots of resources on the aging population in the learning management system as well for you to look at. Thanks for attending this review and for this review on the harm and risk of substance use today.